Welcome back to Healthy Communities News. I'm Hillary Russo. More than 47,000 people die by suicide each year in the U.S., but many suicides can be prevented. The National Suicide Prevention Lifeline is available 24 hours a day and includes call, text, and chat options. Now, there's a new number to call for the Suicide Prevention Lifeline, 988.
When you go to dial 800-273-8255, that's a lot of digits to punch in and to remember. But with 988, it's a very simple number to remember.
Very similar to what we know, 911. Everybody knows that from the time they're 3 years old. Hopefully that 988 number will have that same sort of reach.
Promoting the Lifeline is just one part of a multi-layered approach that Aetna's mental well-being team is taking to reduce suicide attempts among their members by 20% by the year 2025. They're collaborating with behavioral health providers across the U.S. to improve access to support services. One such provider is a Southern California organization named after its founder, Dee Dee Hirsch. Dee Dee Hirsch Mental Health Services offers its community an innovative suicide prevention center. It was the first of its kind in the U.S. and now serves as a model for suicide prevention organizations across the globe.
One of the things, for example, that they have is a survivor of suicide attempt group. It's peer and therapist led.
The peer facilitator is someone who themselves has that lived experience of having made a suicide attempt. They know that person gets what they're talking about, that person has been in their shoes. There's no shame, there's no blame, there's no judgment.
Not only are people going to get new tools on how to manage their suicidal thinking, but then they build community, and it's about finding people that get you and understand you.
Another group that's finding community at Dee Dee Hirsch are families and loved ones of those who have died by suicide.
It's a club people never wanted to join, and here they are. They're telling their story, and it's a safe place to tell that story because the group's moderated by a therapist and co-facilitated by a survivor.
It's an opportunity for people to come together and finding new ways of coping and making connection and community so that they don't feel quite so alone.
The team at Dee Dee Hirsch also works with the National Suicide Prevention Lifeline.
I've been drinking so much today, my head's all over the place.
So you've had some alcohol?
Yeah.
Last year, we did about 136,000 calls, texts, and chats.
We spend a lot of time with the person first discussing all the reasons why they no longer want to live and really understanding what caused them to be in such distress.
It's not about killing themselves. It's about ending the pain that they're feeling. Calling a crisis line gives us an opportunity to help them develop coping skills, to talk about what's going on, to find some kind of support.
The crisis line isn't just for those thinking about suicide themselves. Lots of friends and family call for advice on how to help a loved one in pain. But how can you tell someone is at risk?
You can see a difference in their behavior, in their demeanor. Someone who's always been well-dressed is not dressing as well anymore. Their hygiene is suffering. Things that you can notice. They're like invitations to ask questions about why things are changing with them.
Be very direct and upfront and say to them, when you say you want to go to sleep and never wake up again, does that mean you're thinking of suicide?
The reason we want people to address it directly is because it gives the person an opportunity to finally open up, and you might be the first and only person to have this conversation with them.
And if you're one of those people receiving this information and you don't know how to deal with it, you can call our crisis line as a third party and discuss this with one of our counselors.
Better yet, hand the phone over. We can talk to them together.
Talking about suicide doesn't increase the risk. Talking about suicide gets people help, it gets people resources, and it gives them an opportunity to tell us what's happening with them so that we can intervene.
The pandemic presented a challenge to providing those services, but the Dee Dee Hirsch team quickly shifted gears to a virtual model and was even able to add counselors to their crisis line. Those additional resources are needed now more than ever.
This isolation that we've had since COVID started a couple of years ago has really led to an increase in suicide attempts, specifically among the youth.
We do presentations to young people in an elementary school, middle school, or high school. We do it for administrators. We talk about suicide because we want to bring it out of the shadows. As uncomfortable as it is, I think, for those communities that may need this conversation, I can't tell you how grateful people are. There's a lot of hope as long as people are willing to be open-hearted about having these conversations.
Can we help you stay safe just for today?
If you or someone you know is in crisis, please contact the National Suicide Prevention Lifeline by call, text, or chat 24 hours a day, 7 days a week. Until we see you again, be well.